Well, what is so true and common sense is that if one thing's out of place, it throws other things off. Now, I would say typically in our Western mode of medicine, from my experiences, a patch is put on the problem instead of getting to the root of the problem,
Exactly.
which sometimes is, down Alice's, down the rabbit hole. You get deeper and deeper into before you can really get to the root of it. But how can one be healed unless you really get to the root? And it sounds like what you do, and from my experience, from what you do is you work, getting this in place and then on that, and then getting to the core or the root of the issue.
That's exactly what we like to do. Sometimes you're working within people's lifestyle, and in the perfect world, people do certain things. I'd like to give an example. I have a strong worker who's a patient of mine who he constantly has this upper shoulder pain, and it turns out that the reason his upper trapezius muscle stays tight is because his latissimus dorsi, which opposes that, won't stay on. So he says to me, "Why does this keep happening?" So we do a little investigation, and we find out that the pancreas it relates to that muscle. And so it turns out that we sort out his lifestyle. We figure out something with his pancreas, give him some nutrition to support that. He comes in again a few weeks later, it's back again. Well, a little lifestyle investigation finds out that he's at work and he's eating cookies at lunch instead of having some other food. Now, the question is, why are you eating cookies? So we do a little point the mind, and we find out that, well, the reason he's eating cookies is because he doesn't like the guys he's working with on this particular job. He's a subcontractor. So he's not happy. He doesn't like the guys, so he just eases his pain by having a cookie, which, as we know, sugar and sweet flavors can actually release certain amounts of dopamine, which is what people get addicted to. So in order to feel happy, he has a cookie. And then his pancreas gets stressed, his latissimus dorsi muscle lets go, doesn't hold properly, his upper trap gets sore, his neck goes up. So now he comes to a choice. When he's unhappy at work, can he change his attitude? Can he change his mind? Does he have a skill set for that? Or to just eat the cookie and have the problem? And sometimes people say, "I just want to eat the cookie, doc. I want to eat the cookie, and I want to come in and get fixed every week. I don't care, I just want to eat my cookie." Well, okay, that's within their lifestyle. You can't force people to change.
Interesting. Give us an example of what kind of people come to you. I mean, we talked at the top of the show about an athlete, we talked about an actress. What kind of people do you treat? And maybe you can sort of give us a brief idea of the ailments that people have come.
It varies. Anybody and everybody. Like I say, I've had athletes, I've had people with structural injuries, people who have old traumatic injuries. I have people with actually organic diseases, everything from, I don't treat cancer, but I've had many patients who have cancer who've looked for ancillary care to try to support the body through their processes. I have a patient who was on her last wits because she had bowel and colon problems and was looking at a colostomy bag. And in her mid-30s decided that was a terrible thing, and she was actually contemplating suicide. So she comes in and we get certain things straightened out. And is she 100% perfect? No, probably not. But the fact of the matter is she's functioning and she's doing a lot better. If most people could get that far, that'd be great. So it varies. I mean, it can be for everything from athletes, and a lot of times you have little kids come in, parents bring them in because they're all of a sudden they're misbehaving, and it turns out it's something in the diet, it turns out it's something structural. So pick a problem. I personally believe that there isn't something that exists that's out there that I can't affect in some positive fashion. Maybe we won't change everything, but we certainly can make a heck of a difference.
Well, just say, for example, that you just gave a parent brings a child in, and all of a sudden they're more hyper or angry or whatever it is. They're not focused. How can you tell if it is in their diet? And I'm sure you check different things, but if you narrow it down to diet, then how do you narrow it down even tighter than that? What in their diet?
Well, there's a lot of tests you can do, and the thing about being a kinesiologist and a professional applied kinesiologist, we don't just use muscle testing. We draw from the plethora of resources that are available to us, including blood tests that test for allergies, saliva tests for hormones. There's a lot of factors that we can look at, and so we draw from all of those, and a lot of times it's really as simple as a diet survey can tell you all the difference right there. I have kids. I know when they eat certain breakfasts that aren't the best, and then within 10 minutes they're having a meltdown, and you just can't have that muffin for breakfast. You got to have some protein with it.
All right. Well, yes, and you do have two beautiful kids, Laura and Max. His name is longer than Picasso's. We'll have to shout out to them. how we just have a few minutes left here, just have maybe 4 or 5 minutes left. I wish we had time for calls. I'm sure there'd be a lot of listeners with questions. I don't know, we might have time for one, 818-985-5735, 818-985 KPFK. But we might even have you back next week if
Love
you can.
to be back.
And
We could make that happen. I'd love to be back and talk more, and I'd love to answer questions if people actually have questions. It would be good to do that.
absolutely, we can really help some of the listeners. And I know I've asked you, if you can offer something special, which we'll talk about in just a second for KPFK supporters and listeners of Healthy Planet, Healthy Me. Just want to ask you one last question, and then I want you to be able to wrap it up, Dr. Gordie. What's the relationship? Is there a relationship between quantum physics and professional applied kinesiology?
Absolutely, because when we deal with the nervous system, we're dealing with fingers into the quantum world. So every time you test something, you're changing a person's perspective. If you change the perspective, you're actually changing their DNA. There's proof for that now, that DNA changes from the environment, and that's really one of the biggest factors of that. So there is a huge relationship, because we can actually test these things and test them at different levels. If people want to have a visual of kind of an example of what I do, please check out my website, www.drgordie.com. That's DrGordie.com. And I have a lot of information on there, but there are some video demos that you can look at, and feel free to email me questions from there as well.
Okay, excellent. Just want to remind our listeners, if you've recently tuned in, you're listening to Dr. Gordon Grobelny, or his patients call him Dr. Gordie. He's a board-certified professional applied kinesiologist and chiropractor, and he also practices craniosacral therapy, NLP, and many other cutting-edge modalities. He's been in practice for 20 years, 19 of those years in Washington State, and we're very fortunate to have him down here now, where he's started a practice in West Los Angeles. Let's go ahead, and I know a lot of our listeners are real fans of What the Bleep, the film, and we've got producer-director Betsy Chassie here, who happens to be the wife of Dr. Gordie. And Betsy, I know you guys have offered something special for KPFK supporters and our listeners, so let us know about that.
Yeah, so we're really excited that Dr. Gordie's going to be opening a new office here in Los Angeles. He's been kind enough to move down here so that I can work on a new movie. So he's got a new life here, and he's ready to take on new patients. So for starting the week of September 13th, for KPFK listeners, you can receive a new patient appointment that's a 1 hour, including a full evaluation and treatment, which is normally $225 for just $150. So that's a $75 savings. Or if you're a little unsure about what Dr. Gordie does and you want to just kind of come and check him out, you can get an intro appointment with an introductory evaluation and a treatment, which is about 15 minutes for $75. And you can book those online at www.drgordie.com, DrGordie.com.
Okay, and we'll make sure to put it up on the Sherry Beall, which is Healthy Planet, Healthy Me, SherryBeall.com website, SHERRY, B as in boy, EALL. .com. We'll have all that information up for you shortly, and links, etc., and also a podcast of the show. We certainly want to thank Dr. Gordie for being in studio with us here today. We're going to have him back next week so we can help listeners and just take some calls in and share some more information. Betsy Chassie, we want to thank you, and also a shout out to Laura and Max. Say hey.
Hey.
Hi guys.
Hi guys.
Laura's here today. She's being our professional photographer.
And thank you, Sherry, for having us.
And thank you for having us, Sherry.
Absolutely. We are so happy that you're down here in Los Angeles now, and now we understand why you had a 3-month waiting list up in Washington State. So anyway, thank you, our producer of the show today, co-producer Vito D'Ambrosio. I'd like to thank D'Angelo Jones, our awesome engineer with an awesome smile. To you, our listeners, again, make sure to log on to our website. It's Sherry Beall, SHERRY, B as in boy, EALL.com for any information on today's show and free podcasting. And we also have information from last week. We had info on the reconnection, so that's on there too. Have a fantastic, safe weekend. Thank you.